And that was a piece, and that was a piece from CNN regarding the drug. And now we go to Larry Sparano and his wife to talk about it. Hey there, how are you?
Yeah, good morning, Kent. I have with me now Sharon, my wife, who's been a pharmacist for 47 years. And
Uh-huh.
Kent, she says that this whole thing about withholding hydroxychloroquine is totally unnecessary. We're losing lives because of it. There's no reason why not to dispense it right now. And Sharon
Hmm.
will explain that in detail. Sharon,
Oh,
how
okay,
come how
great.
come they should be dispensing it? Fauci and others say it needs clinical trials and all that before you can dispense it. What do you say?
Well, good morning, Kent. And
Hi.
just a correction. It's 37 years that I'm practicing as a pharmacist, not
Yeah, I said
47.
37. Yeah, Larry said 47. I said
Yeah, he
37.
likes to add some years to my age, but
I
it's
hear you.
37.
All right.
So, good morning, Kent. Clinical trials absolutely, would be necessary if you wanted to get the exact data and give it, scientific data behind the
Right.
COVID treatment. However, hydroxychloroquine has been on the market in the United States since 1955. It is actually listed on the World Health Organization as an effective and safe drug on the World Health Organization and on their drug essential list.
Uh-huh.
So it is well out in the market. We have a safety profile on it already, and it is one of like about 120 top percent drugs on the used yearly in the
Hmm.
United States. So doctors can prescribe this medication and should be allowed to prescribe this medication and how always have been allowed to prescribe this medication until President Trump raised the issue that it showed some promise. And then unfortunately what happened is all of a sudden governors, which seem to be a couple of Democratic governors, which
Hmm.
never happened in 37 years in my career as a pharmacist, starting putting barriers up where doctors were prohibited from prescribing it for COVID for their patients. And
Hmm.
pharmacists were prohibited from filling the medication for their
Hmm.
patients. And this has never happened. So that's the concern I have that something these prohibitions all of a sudden popped up with this medication and they have never been in play ever and
But
have
I mean,
never been
wasn't
put down. So why
but
did
was
that happen?
but wasn't it before?
It's unknown to me why that would have been put in play. Now they're removing these restrictions.
Hmm.
After people started catching on that hydroxy actually is effective. Now,
But what
Sharon,
about
the big bugaboo here has been that the side effects are
side
unknown. You
effects?
can go
Yeah.
blind or worse, whatever. What do you say to that argument?
Well, the side effect profile is actually not that bad with the medication. There is the concern, and it's always been a concern about like the possible retinopathy with hydroxychloroquine.
What's
Now,
that?
that's an eye part. That's an
Uh-huh.
eye, a vision situation
Hmm.
where you can get inflammation in your eye and you can possibly lose vision. However, that does not happen on any kind of a large scale situation. Now, what usually doctors say is have an eye test before you go on the medication, and once a
Hmm.
year have an eye test. It
Hmm.
does not happen under normal dosages. It would be
Hmm.
very rare for it to happen under normal dosage, and that's when you push a dosage beyond normal dosage.
And you're saying
Hmm.
here the dosages are pretty brief, so it's not like you're going to be on it a lot where there could be side effects coming in because of the prolonged use of the medication.
Exactly. From what I can gather and to see what doctors have been using
Hmm.
in the field and out of Italy and China, in the United States, and checking with my pharmacists friends in the hospital settings, they've
Hmm.
been using very like low dosage on the hydroxychloroquine and short term for COVID-19. So we're talking
Hmm.
like 5-day therapy on
Hmm.
like a low dose, normal dosage.
Well, well, what about the heart arrhythmic side effect? I
That's
mean,
a good point, Kent, and you're right on that. It's another thing that if a doctor is prescribing the hydroxychloroquine for an arthritis patient or a lupus patient or a Lyme disease patient. If a heart patient, it's not all heart patients, it would be specific to them if they have a specific type of an arrhythmia. And some arrhythmia patients can take hydroxychloroquine, but specific arrhythmias you have to watch and monitor that heart level. However, it's not that you cannot give it, you have to monitor it. So a doctor would have to be just cautious in prescribing it for that patient that has that underlying condition. But that is not a reason to be afraid of this medication. It is in wide use. We know its effects, and doctors would have to, they know their patient and what their underlying situation is, and they would have to make that decision. But again, my situation was when I started seeing these, coming across, pharmacy feeds that you cannot dispense this, or the doctor cannot do this, and they do this every day. Like if a family doctor wanted to order you 12 tablets, it seems like that's the amount they would order, just 12 tablets of hydroxychloroquine for your treatment of COVID. And it would be considered just this off-label usage. And just to tell you what that means is it's not FDA approved for COVID, but a doctor has the total legal authority to dispense that drug at his discretion because it shows promise for that disease. And and he could legally do that, but he in certain states he's prohibited from doing that, and your state is one. Governor Cuomo did issue such an order, and now he did a little modification on his order, and he still did not rescind it. And it says that a doctor can only dispense it for his patient who's not in a hospital if he has that patient get a positive test results that says they're COVID positive, and then that patient has to present that COVID positive test to the pharmacist, which is a violation of HIPAA. Because a pharmacist does not need to know your disease state.
Your disease, right?
But
yeah, right, exactly.
Under that order, the pharmacist would need to have a copy of the positive diagnosis attached to that prescription in order to be able to legally fill it and protect that pharmacist's license. Again, unheard of in anything in 37 years I've ever seen.
Well, why is this going on? I mean, maybe that's more of a political question, but why are they doing this?
Before we get to that, Ken, Sharon, you should talk about your personal contact with the Michigan State rep who had to argue to get it dispensed to her, and she pulled out of it. Although some of her relatives are in bad shape. Tell us about that.
Well, I'll quickly, I did have a phone conversation. I'm sure you heard about it in the national media. I had a phone conversation with the state rep, Democratic state rep, Karen Whitsett in Michigan. She told me that she went to the hospital because her symptoms started getting very severe. And she felt the very severe congestion in her chest. She went from 0 to 100 very fast. So she went to the hospital, and she did ask them to give her the hydroxychloroquine treatment. She heard about it on television, and she thought that, she really needed to get that in her to stop this progression. And the doctors at the hospital told her in Michigan they could not give her this treatment because the Democratic governor, it was a Gretchen Whitmer, put an executive order prohibiting all doctors and hospitals from dispensing or using hydroxychloroquine. So she tried everything, this Karen, and she could not get them to give her this hydroxychloroquine treatment. So she then ended up getting the treatment from a doctor at a Ready Clinic, a urgent care center. Gave her the treatment. She was able to take it, and she said that within hours, 2 or 3 hours, that chest congestion and everything started relieving for her. And she is still weak right now, but she's doing a lot better. She has family
Right.
members still fighting this, and she lost some family members, but she's
Right.
convinced that that was the, life change for her. And
Right. Well, listen, let me ask you this. Can we, I got to get off now, but can we continue this next week?
Sure.
I mean, it's fascinating. Let me call you guys again next week and we'll do some more.
Okay.
All right?
good.
Okay. Talk to you
Okay.
later. Thank you
Bye-bye.
for coming on. Bye-bye.